Hey everyone, I'm Levi Wright, Assistant Director of Prospective Student Services here at OSUIT, and we're back again with another live virtual tour. And today we're in the nursing program, so we're going to get to go through this program and see what an incoming student will go through as far as the process and what their time here at OSUIT will look like. As usual, if you have any questions, please put those in the comments as we go, because we want to make sure we get those answered for you today. Even if you're watching this later on after we've closed the live portion, you can still put your comments on there and we can still get those answered for you. If you have any friends or family that you think would benefit from seeing this, please send it to them so that they can join in as well. We're glad you're with us today, and I'm going to go ahead and turn it over and let our wonderful faculty, you're not faculty, are you? I'm so sorry. We're going to let Jody Campbell take care of the tour.
Hi everyone. I have been faculty here at OSUIT for almost 10 years. I'm now the Director of Nursing, and I want to welcome you to the nursing building. So let's just start with this beautiful building. We have one of the prettiest places on campus, so when you come here as a student, you're going to be welcomed into this building. It is dedicated for nursing students, so all of the classes in this building are nursing-specific classes. And you can see as you look around that there's a lot of natural light. It's a little dreary here in Okmulgee today, but that's okay. We have a beautiful building, lots of natural light, lots of seating for students. On a normal semester, you'd see students sacked out all over these couches and just really taking advantage of some leisure time. We have a dedicated student lounge here behind me. It's got vending and microwave, and we've really tried to make this building a home for the students when they're on campus. We have a dedicated computer lab, so our students don't have to go elsewhere for their computer needs. They can do that here. So I want to talk a little bit about nursing in general before we talk about nursing specific to OSUIT. So if you've looked into nursing before, you probably know a little bit about how licensing works. But going to school and getting a degree is part one of that process. Then you have to take a national licensing exam. So this program is a registered nursing program, and when you graduate from here, you'll be eligible to take your NCLEX, which is the National Licensing Exam for Nursing, and you'd be a registered nurse. You may also be familiar with a licensed practical nurse, or an LPN. That is a different program. It is offered more at your typical technical schools, and we do also have an LPN to RN bridge program here, which I'll talk about in a little bit later. And then for registered nurses, there are two entry points to a registered nursing degree. You can have an associate's degree, which is what we offer here at OSUIT. And then there's also a bachelor's degree in nursing. And that is something that you can bridge to once you have your associate's degree. So you can have your RN here, and then you can get your BSN. OSU Stillwater has a campus. There's lots of different options for that. And about 75% of our students will go on and get their bachelor's degree after they finish here at OSUIT. So we're big believers in lifelong learning. It's also great that you guys are here this week because yesterday was the International Nurses Day and the 200th anniversary of the birth of Florence Nightingale, who's kind of the creator of modern nursing as we know it now. If you're in the biz, you get to call her Flo, but you have to have your license before you can refer to her as Flo. So she'd be really excited to talk to prospective students today too. So when you decide you want to go to nursing school, you're going to start, like most other degrees, with basic general education. So in this program, we require 33 hours of general education. That's going to include your history and your government and your intro psych and your comp 1 and your comp 2, standard general education classes. For a nursing degree, you're going to be heavy in your sciences. So what we require that you may not have in a traditional degree is 12 hours of lab sciences. So you're required to take anatomy and physiology and general microbiology. If you want more information about the specific classes, I'd refer you to our website. We have our plan of study listed there. The other thing that's a little bit different is you don't admit to the university directly to the nursing program. You can't be a nursing major until you've been accepted to the nursing program. So initially, when you apply or you start taking classes here, you would go for, your major would be pre-professional studies with an emphasis in nursing. And a lot of our students will actually graduate with both degrees, so they'll graduate with an associate in applied science in nursing and an associate's in science in pre-professional studies. And that really sets them up well to go and get that bachelor's degree later on and covers a lot of those classes. So once you've got most of your general education requirements complete, it's time to apply to the nursing program. This program, like all nursing programs, is a competitive entry program. There are a lot of people who want to go to nursing school. And as you know from watching this worldwide health situation that we're in right now, nurses are needed. Nurses are always essential, and it's great that we have a lot of career mobility and a lot of need. That's not to say that you should jump into nursing because you think you just want a job. It is a difficult career. It is a demanding career, emotionally, physically demanding, but it's worth all of that if it's the right thing for you. So when you're ready to apply for nursing school, we have some application guidelines. It is a process. You'll have to apply early. You'll want to look at the website to get the exact dates. We're finishing up our application period for a fall 2020 start now, and we will be introducing our dates for our spring 2020 start, 2021 it will be, start soon. You'll fill out a simple application for us. We do placement testing in nursing. We use the Accuplacer test, which you may have had to take as an incoming freshman possibly. That just assures us that students coming into nursing have the basic scholarship ability, scholarly ability to be successful. If you know anybody who's gone to nursing school, they'll probably tell you it's the hardest thing they've ever done. Nursing is a rigorous program. It's academically challenging. And so we want to know that students coming into our program are set up for success so that they will graduate and they will get licensure. So you'll take your general education classes, you'll take your Accuplacer test or your placement test. We also take a look at your GPA. You have to maintain at least a C average or a 2.0 in all of your general education classes to qualify for nursing. There are additional points available if you get B's and A's or you carry at least a 3-point average. We'll look at that for your application. Once we have everybody applied to the program, we total up the points. We take however many spots we have available. We typically admit 45 students twice a year, so we do a fall and a spring admission, and then those students are in the nursing program. The nursing program itself is 4 semesters here. We do not teach our primary nursing classes over the summer. We leave the summers open for externships, and I'll talk about externships a little more when we look at some of our spaces. But once you're admitted to the nursing program, you're going to spend 4 semesters with us in this lovely building and in our classrooms and in our labs. So if we want to kind of walk that way now, I'm going to show you your labs and show you what you'll be doing once you get started. Should we go this way around the skeleton? Nurses have to have a sense of humor, so you can see we like to enjoy ourselves here. And one of the great things about, I had to remember which sign that was, one of the great things about OSUIT in general is that it's a big enough school that you have a lot of opportunities, there's lots of extracurricular activities, there's a community on campus. You really get to feel like you're getting that college experience. But it's also small enough that you're not lost in a crowd. You really have the opportunity to connect with fellow students, to connect with your faculty, and really become a part of a community. And I can tell you from my own personal experience, both in college and then looking for a job later, if you can find the place where you fit, and as our slogan says, be true to you, that's where you're going to find success. So I'm taking you into our lab area here. Our students spend a lot of time in the classroom, obviously. You got to get the theory down. Students in each of our semesters are going to spend 6 hours a week in a classroom. That's just the way that works. But the rest of the time, they're going to do lab work and they're going to do clinical work. So we're going to take you into our skills lab here first. This is somebody's office, but I wanted to show you, we kind of have, if you guys want to take a picture here, it's pretty technical. So if you look over at this wall, we kind of have a command center here. So we have a simulation lab coordinator, her name is Catherine Bible, and she hangs out in the lab when she's got students doing it, and she kind of controls everything from this almost Star Trek looking command station here. This is one-way glass, so she can see what's happening with the students, but they're not interacting with her. It helps them focus on actually taking care of the patient and not trying to talk back and forth to an instructor. Those are simulations that are done in our 2nd, 3rd, and 4th semesters. So if we come back out this way, you'll notice as you're kind of looking around that this feels very much like a hospital ward. It was designed for that purpose. When students are in the lab, we want them to feel as much as possible like they are in the actual healthcare setting. It helps when you have that situated learning. It helps you to take it seriously when it feels like it's the real thing. So this is the simulation side of our lab, and we have a variety of tools and techniques for our students. What they would do in lab, let's start with 1st semester. So we're going to take ourselves through the program. 1st semester is Foundations of Nursing, and we don't require that you have any medical experience at all when you come to school here. If you've looked around at nursing programs, you'll see that there are lots of them that require you to be a CNA or a home health aide or something like that. We don't. There's reasons for that, good and bad, but for our purposes, we just feel like we want people to be able to walk in the door if nursing is their passion. If you have experience, that's fantastic, but if you don't, that's okay too. I didn't have a drop of experience when I went to nursing school, and 22 years later, I'm still doing it. So it can work for both situations. But in foundations, if you don't know anything or if you've never had any kind of healthcare, we're really going to start at the beginning. We literally start week 1 with hand washing. And again, in a global health pandemic, we all know how important hand hygiene is. So we literally start with hand washing and bed making and bathing, and we teach you how to do physical assessments. So we teach you how to use a stethoscope, and we teach you how to use a blood pressure cuff, or the fancy name for that is sphygmomanometer. See if I could even say that on a live Facebook video. We teach you how to check pulses and how to listen to lung sounds and how to assess a patient's skin. We really focus on that head to toe. We're also teaching you the nursing process. How do you go about interviewing a patient and getting their health information and putting the pieces together and saying, oh, well, this complaint sounds like it's this issue, and I know as a nurse, I now have to do this thing to help my patient and report to the physician and get the medications and that kind of big process you think about with nursing. We spend a lot of time in our skills lab, which we'll walk in there in a minute, but they're very similar labs. Like I said, you start with hand washing and bed making and bathing. You learn IV insertion, medication administration, how to put in an NG tube, how to change dressings. Trying to think of some of the other things in first semester, how to take out stitches and how to take out staples, and how to do tracheostomy care for patients who might have a tracheostomy, how to apply oxygen for patients. So really, if it's something that has to be done to the human body, at some point in nursing school, you're going to learn that. So that's first semester. All of our semesters, like I said, you're going to spend about 6 hours in the classroom in theory, and then each semester's lab time varies just a little bit. In the beginning, in first semester, you spend 2 to 3 hours a week in lab. You're broken up into groups, and you're practicing a specific skill each week, so you're learning your skills. In our second, third, and fourth semester, students spend on average 1 hour a week. Sometimes it's 2 hours one week and then not lab the next week. And that's going to be focused more on simulation and patient care experiences. You're continuing to learn skills as you go on, but in second, third, and fourth semester, it's really focused more on simulation. And then you'll do clinical. So that's the other thing that's fun about nursing school. So we can only teach you so much in the 4 walls of this building, and with our pretend, although very fancy mannequins, we can't really teach you that patient interaction. So in nursing school, you're also going to spend a lot of time at the bedside somewhere. Our students spend typically a day a week, and that is an 8 to a 9 hour, sometimes 12 hour, depending on our schedules, day in a healthcare facility with a supervised rotation. So you always have a nursing instructor there with you. We do everything from birth to death. So in foundations, we really focus on long-term care and the care of the older adult. Those students are going to start in a skilled nursing facility and in a nursing home, just learning how to interview patients. Particularly if you have no medical experience at all, just walking into somebody's room and putting your hands on them and listening to their lungs and asking them questions that are kind of personal and sometimes intimate. It takes practice, so you have to learn how to do that. So we kind of focus on nursing assessment there. And then we progress on and spend time in long-term acute care facilities where the patients are longer-term patients but still very medically ill and requiring a lot of care. Our second semester is nursing care of families, and that is what we call our specialties semester. So it's almost 3 mini classes put together. You'll spend about 4 weeks in mental health care, so you're learning psychiatric care. That's everything from learning about psychiatric disorders and medications and the specialties of psychiatric nursing. It also is a lot about therapeutic communication, caring for patients who might have mental health issues. You will do clinicals in that section as well. We do inpatient and outpatient observations in mental health facilities everywhere in the Northeast Oklahoma area. The second piece of that class is obstetrics. So that's where a lot of people are very excited about labor and delivery when they go to nursing school. That's a real common thing where people are super excited. You do get to go to the hospital, to a labor and delivery unit and a postpartum unit, and learn to care for the laboring patient and the newborn and the family, because family nursing is so important, taking care of those patients. And you're getting the theory behind it, so we do learn how babies are born. You probably come into the nursing program knowing how babies are made, but we'll talk about some of the specifics of that too. And then the third part of that semester is pediatrics. So then you're getting kind of the specialty on pediatrics. Sometimes if you're not in the medical field, you tend to think as pediatric patients or kids as just small adults, but really they have their own health needs and their own health assessment, and it's kind of its own little world of nursing. So patients need something different from healthcare providers in pediatric. Again, that's definitely a family situation. If you have kids of your own or nieces or nephews, you know how when your child is sick, everybody in the family is involved in that. So again, we focus a lot on the family there. And our students do pediatric clinicals, so we primarily do those in Tulsa at St. Francis Hospital, at the Children's Hospital. And they get to go to pediatric ICU and pediatric ER and oncology and cardiology and general medical surgical. So our students really get great experience in the healthcare settings. We also do a lot of community work in mental health and pediatrics, meaning we might go to daycare centers or do some teaching presentations, lots of different ways to just allow our students to interact with that population. And then in your third semester, it's called our General Medical Surgical semester, or Beginning Med Surg. The technical title of the course is Nursing Care of Adults Part 1. That's where you're really going to get into the ins and outs of how do I care for a patient who has asthma? How do I care for a patient who has diabetes? How do I care for a patient who has a musculoskeletal disorder, renal failure? So you're really learning the specifics of the systems in that semester. Again, 6 hours in the classroom every week, about an hour to 2 hours in the lab every week, and then you'll go to clinicals. In third semester, those clinicals are adult health care, and they're almost exclusively done at the bedside in acute care settings. So St. Francis, St. John, Hillcrest, OSU Med Center, St. Francis, Muskogee, and any other place that we can find that we need to take students to. And they work side by side with the nurses in the hospital, supervised by faculty, learning how to do that bedside care. Finally, fourth semester, which is our Nursing Care of Adults Part 2, and it's Advanced Med Surg. This is our critical care semester. So in fourth semester, you're going to learn about a patient who's having a heart attack, a patient who's having respiratory failure. If you've been watching the news and learning about COVID, you've probably heard the term ARDS, ARDS. That's what happens when patients have that really advanced coronavirus and they get their lungs filled up with fluid. So we teach that. We teach you how to watch for that and teach you how to care for those patients, and talk to you about how ventilators work and how you're going to care for a patient on a ventilator. In that semester clinicals, you're at the bedside in critical care areas. So again, our students get to go to cardiac ICU, medical ICU, surgical trauma ICU, neuro ICU, ER, GI lab, again, just all over the specialties. By the time you graduate from nursing school, you have approximately 450 hours at the bedside in a healthcare facility. So you really are getting that opportunity to work with patients of all kinds of varieties and learn a lot. The other thing you really get out of clinicals, and sometimes we skip over this a little bit, but clinicals teaches you how to be a professional. It teaches you how to work on teamwork and collaboration and interdisciplinary care. It teaches you how to talk to patients and how to talk to families and conflict resolution and time management and all of those things that make you really a professional nurse. It also gives you the opportunity to practice. We think about the art and science and health in this school. The science of nursing is what we learn in the classroom. The art of nursing is what we learn by actually taking care of patients and what we learn by watching other healthcare practitioners, nurses, doctors, respiratory therapists, physical therapists, how they talk and work with patients and how we all work together as a healthcare team. So let me show you just a little bit about the lab. You can probably hear the beeping behind me. I do have one of our mannequins turned on over here. What the students do in the simulation, the point of simulation is for them to get to practice being the primary nurse. So when you're at clinical, even though you're taking care of the patients, there's a nurse there who's actually in charge of taking care of those patients. You're getting to practice with the nurse. In the lab, you get to be the nurse all by yourself. No instructor. The instructor is behind the wall. You can't interact with that person. You usually have a team, so we set it up where there's a primary nurse and a secondary nurse. You have a patient and you have a scenario, and it's your job to walk into that room with whatever information you were given and care for that patient in that instance. And we use simulation to kind of give students experiences that they might not get to have in the hospital setting. For instance, we can't make sure that every student in a nursing program gets to care for a patient who's having an asthma attack. but we can do that in the lab. We can give every mannequin in here asthma, and we can have every single mannequin in here have an asthma attack and have all the students practice that. So that's kind of what we do that for. And that allows students to get practice. It also allows students to make mistakes, because you're going to make mistakes, you're human beings. And when you make mistakes in the lab, then you learn how to avoid making those mistakes when you get out into the real world. So it really serves that purpose. These mannequins are pretty fancy. I don't have him turned on to do anything super exciting right now, but you can see we can program him to have normal vital signs, as you see up there. I could program him to have no heart rate at all if I wanted to. I could program him to have respiratory difficulty. You can, I don't know if you guys can see it very well, but he's breathing. His has chest rise and fall. If I put my stethoscope on and listen to him, he's got breath sounds. I can hear the air moving in there. I can listen to his heart. I can come over here and I can take his pulse. We can give him medication. We can put NG tubes down if he needed feeding. We can give him medication via IV. We can shine a light in his eyes and watch his pupils actually dilate. So it really gives the students to practice on what we call high fidelity, meaning as close to a real human being as we can get without it being a real human being. The other thing that we practice here in the lab is just interacting and making all the things work together. So one of the things that's kind of hard about nursing, and this is true of a lot of professions, but there's a lot going on, right? I'm not just taking care of this patient. I'm taking care of this patient and 5 more down the hall, and he might need medication, and so does somebody else, and I have to listen to the beeping and silence the alarm. I have to maybe come over here and get a medication out. So let me sign onto this real quick, and I'll show you how this works. One. Does anybody have any questions while I'm typing over here that we can answer? Oh.
Not really. We've got a very excited prospective student that's hoping to apply for the spring of 2021.
Great.
And just expressing the excitement of getting to see this live tour. So
that's outstanding. I'm glad we could provide that for you. Yes, so we'll have our dates for our spring 2021 application period on the website by the end of May. We're still figuring out a couple of things as we adjust our dates for this fall. But anybody who's interested in nursing, reach out to us. Emails, all that stuff's on the website. Call us. We can do Zoom stuff. We can talk to you on the phone. We really like to talk to students individually, as well as what you can find on the website, so that we can do a very personalized advisement for you. So we're going to skip that because I can't apparently type and get my password in there the right way. But this is the medication dispensing machine. These drawers are all filled with medication, and the point is, it's very much like you're going to see in the hospital setting. If you've taken care of, you have family members in the hospital, this is literally what the nurses work with in the healthcare setting. So they get to practice here, they get to see the real stuff, and then they get to apply it in the workforce. That's all we're about here at OSUIT, is that applied technology. Let me show you the skills lab over here. How we doing on time? They told me I had to talk for at least 15 minutes. I was like, ask a former student, I'm good to go on that kind of thing. As I'm walking over here, I mentioned that my favorite thing about OSUIT is that it's a big enough school to have opportunities, but it's a small enough school to really get that one-on-one experience. And I'm going to tell you, the best thing about our nursing program is the faculty. If you ask our students, you're going to hear time and time and time again about the expert faculty on this campus. They are experienced nurses, they are experienced educators, but most importantly, they're passionate about what they do. And we are really, our whole job is to support students and help them through this journey. So this is just the other room. This is our skills lab. You can see we have a whole host of mannequins over here. I didn't show you, but we do have pediatric mannequins, we have infant mannequins, so again, we cover that whole range there. I mentioned our traditional program. We do also have an LPN to RN admission process. So we have an LPN to RN bridge, and what those students do is they take a short and 8-week summer class with us. That's a transition to nursing practice. Gives us an opportunity to refresh study skills and test taking, and really talk about what's different in the LPN versus the RN role and how we do nursing here at OSUIT. And then those LPN students will join our 3rd semester. So that's an 8-week class and then 2 semesters. That application period is closed for this year. We do the LPN summer class, and then they join our students in the fall. But again, check our website. We'll have our LPN to RN open again next summer to admit those LPNs, and we love having our LPN students here. LPN students have to meet all of the same general education requirements as traditional students, so the pathway looks very similar. They just, by virtue of their nursing license, they don't have to take first and second semester. So it's basically cuts the program in half. I'm trying to think what other questions I was supposed to answer. Can you guys think of some stuff you need me to talk about?
I can think of a few, but we do have a few that have come
Sure.
as well. One of them is, how can students increase their chances of getting into the program?
So we do have a point system to get into the program, and that is on the website. You can see it. But the two things I tell students, if you are right out of high school or you're just starting your journey, you want to focus on getting into your classes and completing your classes. I can't tell you how important it is to stay enrolled, stay connected with your advisors, and you want at least C's. B's and A's are better. So you really want to, in the beginning, focus on getting into the classes and getting them complete. The other place where you can earn some points on our admission is by improving your Accuplacer score. So if you've taken the Accuplacer before and you passed, but maybe you were just right at that level, look into some tutoring opportunities, look into some additional study opportunities where you can maybe improve your score a little bit, and that's going to give you some more points as well. I should also say you don't have to have all your general education classes complete when you apply with us, but you get points for the ones you have finished. So if you're, missing a science, for instance, when you complete that class and it's on your transcript, that's going to improve your scores as well.
Okay, and that may have answered the next one, but another person asked, can a student take microbiology in conjunction with the nursing program, or is it a must to have it before starting?
It's not a must to have it before starting. You can take it. The challenge that you're going to run into is that with your sciences, you'll have the scheduling is hard. So you don't have to have it complete when you apply to the nursing program. And the way we do our admission, we're almost a semester ahead usually of when we start. So you could certainly take it in the summer, but no, you do not have to have those complete. While we're talking about sciences, I should also toss in for our non-traditional students out there. First of all, our average age in this program is 27. So don't feel like if you're not right out of high school that you can't do this. Come back to OSU. Non-traditional students do really well in this program. There's a lot of space for you here. Your sciences don't ever expire. That's something different that OSU IT does that a lot of schools don't. We're not going to ask you to retake your sciences. Even if they're 20 years old, if you had a college class and it's a science, it counts. So we try work really hard with students to minimize the work that they have to repeat. So that's a nice benefit.
Excellent. And this was kind of covered a little bit earlier, but just can you re-elaborate? We had someone ask, do I need to pursue a bachelor's degree in nursing if I have the AAS? What would be the advantage?
Okay, so you don't have to, no. You are already licensed as a nurse. So you're licensed as a registered nurse. The difference between an associate degree nurse and a bachelor's degree nurse is the education component, not the nursing component. So once you have your RN licensure, you don't ever retest for that. So what happens in an RN to BSN program, for instance, is they focus more on leadership and they focus more on community. Plus, then you have that well-rounded liberal arts education. So there's more humanities and that kind of thing. The advantage at the bedside is there are positions in the hospital that you can't have with an associate's degree, primarily management. So it is not a requirement. It does not change your salary for the most part if you're doing the same job that an associate degree is. But if you think you want to be a manager at some point, or lots of nurses are interested in becoming nurse practitioners or maybe nursing educators, that's a field that's open there too. You will need your bachelor's degree for that.
Awesome. Here's another one. Is high school anatomy and physiology different from college anatomy and physiology?
Yes. So the body is the body. However you're learning it, wherever you're learning it, the scope, as we say, is going to be different, the same. What's going to be different is the depth at which you go into and the rigor that is expected. Now, that being said, if you had a great anatomy class in high school, you're probably going to do great in anatomy in college too. But yes, they're not going to cover different things, but they're going to cover more depth in your college classes.
Excellent. Is there anything you would say as kind of a final hoorah to a prospective student considering the nursing program at OSU IT?
I would say come see us. However excited you are about seeing us live, keep pursuing that. Keep at it, keep coming. We're going to take care of you. That's something we do here, is we take care of our students. So if we can get you in the door, we're going to show you how exciting it is to be a cowboy and how much you're going to love this program. So just come and see us and stick with it.
Excellent. Jody, thank you for taking the time today to do this live. We do appreciate it. Thank you all for joining. Again, if you have any questions that you didn't get to ask or weren't answered, go ahead and put those in the comments, and we will keep an eye on that and get that information back to you. As she said, go ahead and reach out to the nursing program. You can ask them questions there as well and start getting some more of that information as we move forward. Thank you all so much for joining us today. Remember to like and follow the Friends of Pete on these platforms of social media so that you can keep up with other programs as we move forward. And remember to stay safe, stay true to you, and go Pokes.